There is conflict in all aspects of our life, and we see it, in our families, in our communities. We see it in the government. We see it nationally and internationally. But as an organization, we have been increasingly focused on healthcare, because healthcare, we find conflict to be so prevalent within hospitals and within clinics, and the impact of conflict is so severe. Let's go into a hospital system and think about what are the types of conflicts that exist within a hospital. And let's just take the example of a nurse. The nurse is in the middle. She or he is working in a high-stressed environment. And the nurse is getting pressure from different points in her daily work. She has the pressure from the physician. Sometimes the physician has a very strong point of view. There are some physicians that might be considered disruptive physicians, high conflict personalities. The nurse needs to interact with that physician on a daily basis. Typically, before surgery, there's a pre-op meeting, and the physician and the nurses meet together to discuss the surgery before it actually takes place. Well, in this particular hospital, there was so much conflict between one of the lead doctors and a nurse on the team that the doctor refused and the nurse refused to actually interact with each other in the pre-op meeting. If I was a patient going into surgery, I would like my whole team to be meeting together, not to have this divisive situation occurring. And how is this typically handled in a healthcare environment? It's handled poorly because what typically happens is that it's avoided. No one wants to deal with these issues. People tend to avoid conflict. They walk in the other direction. Then there's the patient. Like we said before, these patients are coming in, they're very stressed. Sometimes they actually exhibit high conflict behaviors, not because they have high conflict personalities, it's just that they're in so much pain that it alters their personality, and that challenges the nurse. There's great cost to this type of conflict that we're seeing in healthcare. There's great cost to the individual. Facing this type of pressure day in and day out, impacts their morale. It makes them less productive and increase errors. There's this graphic we often use in our training where it shows it's a bell curve of anger, and as anger increases, the decision-making decreases. So you get at the point where, at the highest point of anger, you have the least ability to be rational. And it's at that point where you're frustrated where all these errors and challenges actually occur. By 2020, there's going to be increase of need for staff by 25%. Given that situation, how are you going to attract physicians and nurses to your hospital if there's a culture of disrespect? This is what needs to change. Fortunately, there really is a solution to this conflict in healthcare and the miscommunication. And what our focus is at the National Conflict Resolution Center is early intervention. Let's not avoid these issues of conflict. Let's come up with an integrated system to try to deal with these issues before they escalate. We've come up with 3 levels to try to address this issue. The first level is one-to-one, teaching basic communication skills to the frontline staff. Then the exchange is a second process. It's an informal process where managers and supervisors in a hospital can address conflict in a mediation-like process. And then there's the more formal mediation process. So you have 3 levels before the issue really spirals out of control. So we think about it as an integrated conflict management system for a hospital. Early intervention, all of these levels to try to get at the issue, to try to resolve the conflict before it really escalates and gets out of control. And there are a lot of benefits. Less stress, less medical errors, less turnover, Morale goes up, productivity goes up, satisfaction, and most importantly, the culture. We were talking about the culture of disrespect. Through this type of system, we now have a culture of respect.